In a continued effort to enhance the quality and accessibility of mental health services across Saint Lucia, the Ministry of Health, Wellness and Elderly Affairs, in collaboration with the Pan American Health Organization, PAHO, has launched a joint initiative aimed at strengthening capacity within both inpatient and community-based mental health care. The initiative underscores the government's commitment to promoting a rights-based approach to mental health, ensuring that all individuals receive dignified and compassionate care. As part of this initiative, a 5-day training of trainers workshop held from October 13th to the 17th, 2025 brings together mental health professionals and individuals with lived experiences. The training seeks to build national expertise and empower participants to serve as advocates and leaders within the mental health system. Chief Medical Officer Dr. Sharon Belmar George explained that the training will play a critical role in ensuring sustainability and continued growth in the delivery of mental health services.
The training is for about 30 healthcare workers and is actually the trainer to ensure that there is sustainable capacity with the training that we are receiving. So we have 2 consultants from the Pan American Health Organization that are here today. This training is very timely and it's also critical at this point. We have been working with Dr. Sumitra, who's also a PAHO consultant. He has come in and he's done an assessment of our mental health management within the country. He's done quite a few stakeholder consultations in country and he has identified the gaps for implementation and also for improvement. Our mental health policy should be finalized by the end of the year, and we also did a review of our mental health legislation, which we should also have the first draft by the next quarter. We've also put in place a director of mental health services, and all of this is to allow us through the assessment of our system. We've noted that we have quite a few gaps, and we want to ensure that our healthcare workers are well trained, ensuring that we respect the human rights of our mental health patients.
A consultant with the Pan American Health Organization and facilitator of the training workshop, Jasmine Calher, explains that the training focuses on helping health professionals reflect on their current practices while building on existing strengths and identifying realistic opportunities for improvement.
Globally, mental health has become a bit of a challenge. We know that there's lots of evidence to know that mental health care services, the way that they are provided, are often violative of people's rights. But with now the UN Convention on the Rights of Persons with Disabilities, there is a harbinger for hope, there is a guidance for what we need to do, and quality rights is one of those frameworks that helps to reorient practices from a very biomedical model of care to a rights and recovery-based care. So the training this week is going to focus on how do we reorient our practices, how do we bring together good examples of care that we're already providing and what more can we do within the resources that we have, and being realistic of what's feasible, but actually move towards a rights and recovery-based care.
Adding to this, Dr. Claudina Cayetano, a consultant with PAHO, who was also a facilitator at the training workshop, commended Saint Lucia's progress in integrating mental health into primary care and its continued efforts to improve overall well-being.
Working with PAHO as the advisor for mental health, I've seen a lot of changes for Saint Lucia in terms of looking into this integration of mental health into primary care. I was here before because we were doing a training for healthcare providers on a program we call Image Gap, and this was to help healthcare providers to recognize, to manage mental health condition at primary care level. So I'm very pleased to see how Saint Lucia is really focusing on mental health, on people's well-being, because that's actually what matters, to be able to provide better services for their people. So this is a great move for us to be here now to do the training on quality rights.
Through strategic partnerships with organizations like PAHO, Saint Lucia is taking important steps towards creating a more inclusive, equitable, and rights-based mental health system. From the Communications Unit of the Ministry of Health, Wellness and Elderly Affairs, I am Monica McCoy reporting.